Good afternoon and welcome to Nebraska Medicaid EHR Incentive Program. Today's webinar will be How to First Time Attesting with EHR. Next slide, please. Our governor in the state of Nebraska is Pete Ricketts, and we would like to share his vision, mission, priorities, and values in working for and with our state. Next slide, please. There's a fair amount of contact information on this slide. First of all, if you are experiencing any problems, either call the help desk or email NET with your issues, and they will help you get this webinar moving. Also, throughout the webinar, we are asking that if you have any questions, you email us, and that is the middle email address, dhhs.ehrincentives@nebraska.gov. We will try to answer all email questions that come into us live during the webinar. However, if you think of any other questions after the webinar, or if we run out of time before we can answer them all, the questions will be consolidated into a frequently asked questions list specifically associated with this webinar and will be posted on our website. Our website is also listed on this contact slide. I want to let you know that we already have the PowerPoint slide deck on our website. If you would like to retrieve it, it is an expanded version with a little bit more information that you might hear us talk about today. It will be on our website. We are recording this webinar, and when it becomes available to us, we are also going to post the actual webinar itself. And of course, later when we've accumulated all the questions, we will post the frequently asked questions associated with this. Next slide, please. So this is the overview of what we're going to do today. And I want to introduce those of us here who will be speaking or assisting in the process of delivering this webinar. We are very privileged to have a guest provider, Melanie Householder. And Melanie is a Louisiana native and has been caring for people at Express Care Family Medicine since 2007. She completed her undergraduate degree at Northwestern State University of Louisiana in 1994, then moved into inner city Atlanta to provide nursing care for the homeless for 2 years. It was then that she decided to become a nurse practitioner. Melanie graduated from Baylor in 2000 and has been board certified by ANCC since that time. Prior to moving to Nebraska, she worked in a family practice setting in Texas. Welcome, Melanie.
Thank you.
My name is Diane Rolfsmeyer, and my colleague in the program, EHR program, is Karen Moran. We are both program specialists with EHR Incentives. And we are being ably assisted in this production by our assistant, Patty Doble. We will be covering a series of discussion points. We will be looking at a brief history of EHR incentives, the benefits to enrolling, eligibility. We will go through a step-by-step registering and attesting process. We will provide information, important information, and helpful tips. And then at that time, we will look to any email questions that may have come in. And so with the housekeeping out of the way, Karen, will you share with us some of the history of the EHR incentive program?
Yes, thank you, Diane. On our next slide here, we talk a little bit about the history. There's a few bullet points about it. And just to kind of summarize the history of this program, it was started to encourage providers to obtain and use electronic health record technology. The Nebraska Medicaid EHR Incentive Program started in 2012 and will sunset in 2021. Eligible providers enrolled in the program can receive up to 6 annual payments. Next slide, please. There are a number of benefits to this program that we wanted to be sure to let you know of. For providers, one of the main benefits is that you can receive up to $63,750 for full participation in the program. In addition, there are benefits to your patients, of course, and those, we have some of them listed here: faster diagnosis, practice efficiencies, care coordination, and patient participation.
Melanie, we are so pleased that you are here to share your professional perspective to our listeners in this process. How have these benefits affected your practice and your patients?
Well, in several ways. Primarily with the financial incentive, we've been able to maintain our electronic medical record, and we've actually been unique in that we have had 3 electronic medical record systems, so it helps defray the cost of that. Some of the requirements for meaningful use, more in your latter years of attestation, not necessarily in the first year, actually encourage you to use your medical record and access some of the patient care items that you may not have known were there. So we find that very beneficial as far as education tools, the patient portal, providing access for our patients to reach us easier.
That's wonderful. Thank you.
Next slide, please. Okay, so now we talk a little bit about who's eligible. This program has very specific provider types that can be eligible for this program, and we have them listed on this slide: physicians, dentists, certified nurse midwives, nurse practitioners, and physician assistants who practice in a federally qualified health center or a rural health center, which is led by a physician assistant.
So we have another question for you, Melanie. And actually, I was just thinking, based on your previous answer, I have a follow-up question that's really associated with this. But first of all, could you describe your eligibility type and how you have been able to assist other providers in your group with the process of attesting? And the follow-up question is, could you describe to us how large your group is and how many of the providers in your group are enrolled?
Well, the first part of the question, I'm eligible as a family nurse practitioner, and we do a test with our group data. We have, for the initial attestation, we see a large population of Medicaid patients, and Karen, you can correct me if I'm wrong, but you have to see at least 30% of your population needs to be Medicaid.
That's right.
In order to qualify for this program, and we see well above that. Right now, everyone who has been in our group has either attested for AIU. We had 3 providers this year that we submitted their data for the initial first year. We are a unique practice, and it's a very difficult practice setting, so our providers tend to fluctuate in that they may find other opportunities elsewhere. So right now, actively, that we are collecting their data for this year, I have 4 providers that we are working with and seeing how things go there.
Okay, thank you very much.
Okay, next slide, please. All right, on this slide we have some additional criteria that we've listed in order to be eligible for this program. You must be a current Nebraska Medicaid provider. You must be registered with Medicaid through CMS and not already registered with Medicare. You need to have adopted, implemented, or upgraded to a certified electronic health record system prior to attesting. You can't be a hospital-based provider, which means 90% or more of your patient encounters in the previous calendar year cannot have occurred in a hospital. You can't have any current sanctions, and like Melanie said, 30% of your patient encounters over a consecutive 90-day period within the preceding 12 months must be Medicaid encounters. There is a note here that it's 20% for pediatricians is the requirement. And what do I mean by an encounter? The easiest way to describe a patient encounter is when a provider sees their patient face to face.
I have another question for Melanie, but I've noticed that a question has come forward on our email. And so I'm going to put this out here, and Karen, you might be able to answer this. Are public health dental hygienists eligible for EHR incentives?
No, dental hygienists are not eligible. For a dental practice, it would just be the dentist who could potentially be eligible.
But thank you very much for that question, and I want to remind everyone listening, if you have a question, please take the time to send us the question via our email address, and you will notice that our email address is on every slide, so it should be available to you at any time. So getting back to the criteria, Melanie, regarding this patient encounter criteria, did this pose any reporting confusion, and if so, how did you work through or come to understand this concept?
Well, I think a lot of it is addressed in your electronic medical record system, and part of it for me was learning to trust the system and looking through and verifying, okay, yes, if I count them with my fingers, I get the same number as it's telling me on my report. It's doing the right thing. Most of your electronic medical record system should have a reporting function where you can, through that, go and look and see how many patients you have that you have seen that are Medicaid if you have correctly designated them through your insurance billing section. So that clears it up a little bit. It's a little confusing when you first start, I think, but it's a trust issue, or just learning to trust that the system is doing what it's supposed to do.
Thank you very much.
Okay, on to the next slide here where we discuss registering and attesting. We have listed a number of bullet points, and this is to help you as a provider register for the program and attest. So I'll just go through those here. The first step would be, before you can gain access to our web portal, the Nebraska Medicaid EHR Incentive Portal, you need to register with CMS. This can be accessed on the left-hand side of our portal and our website. Our portal address is listed here. We have a link out there that says register with CMS. You can click on that and it'll take you to where you need to be in order to register. Once this has occurred, you'll be sent an email invitation to register with us, and this generally takes 24 to 48 hours. You can access this invitation by clicking on the provider web registration link, and that's on the left-hand side of the screen on our portal, or via the link in your email. Enter the required information to locate your provider profile, and then enter your username, password, and you'll need to answer some security questions. Once your account's been created, an activation email will be sent to you. Click on the link provided in the email to activate your account. And once you've gone through the questions on the attestation, you'll need to click I agree at the end of the attestation, and this will allow your attestation to be sent to us so that we can start the review process on it.
I'm going to interrupt before I go to Melanie again, because we are getting email questions, and while we have an opportunity to answer them, I'd like to take advantage of that. The question that just came in is, will this help us in a nursing home?
Well, it kind of depends, because the Medicaid EHR incentive program is by provider type. It's not by facility. It's not by a type of facility. So we'd have to look at who the providers are that work in the nursing home, if they're part of our eligibility criteria. And the other important piece of that is to remember that 30% of your encounters need to be on Medicaid, and sometimes I think with the nursing home that becomes an issue if they're more on Medicare than on Medicaid. So certainly if you have specific questions regarding that, email it to us and we will review it and get back to you.
Thank you. And we have more emails coming in. We had a follow-up to the one you just answered, so I believe you have answered this individual's question about registering as a facility versus an individual. We also have a question specifically on the clarifying the criteria, what registered with Medicare means.
Okay, that's a good question. This registration process can be a little bit confusing. What it means to be registered with CMS is basically CMS has your information, and maybe Melanie, as a provider, you can kind of speak from your side of it, but at least from the state side, it's basically that CMS has your information and is in communication with us as the state, so that we know if you are going with the Medicare EHR incentive program or the Medicaid EHR incentive program. It's important to clarify here that Nebraska, the state of Nebraska, our department, runs the Nebraska Medicaid EHR incentive program. Any Medicare EHR incentive program is run through CMS. So if you are considering going with Medicare, you'd have to contact CMS directly. But we are certainly happy to answer any Medicaid-related questions.
Okay. And so that brings me back to you, Melanie. With this process of registering and attesting, you had said earlier that it's trickier the first time, and it gets better. Did you experience any challenges with this process? And if so, what were those challenges and how did you overcome them?
Well, initially, I did my first attestation in 2012, and the initial attestation is really quite easy if you have a good electronic medical record system to generate the reports for you, and you have you're utilizing that. Going through the website is actually very easy. I would say if you have any more questions about how to register prior to attesting, the state website does a really good job of directing you where you need to go. Or if you go to the EHR incentives website, there's a link directly on there that takes you to the registration portal. Isn't that correct, Karen? I think it does.
I think so. We recently updated our website, but certainly on our portal. Is that what you said, Melanie? On our portal, on the left-hand side, you can click on the link that says CMS registration, and you'll be taken directly there.
So doing it online is easier than doing it on the paper that was initially required.
And I believe you did a test in 2012, and it was still paper at that time, was it not?
Yeah, I think the first 2 or 3 years that I sent my information in, it was paper.
So it's much easier electronically, and thank you for affirming that.
Okay, on our next slide here, we talk about a couple of helpful tips. The first one I wanted to point out is when you're on our portal, the Nebraska EHR Incentive Portal, on the left-hand side, you'll notice a link called the user manual. If you click on this, it will open up the provider user manual, and it will give you a lot of good information on registering, attesting, just lots of questions as you go through the attestation that it should be able to answer for you. But if not, certainly do not hesitate to contact us. We are very happy to help out providers and answer questions to the so just answer questions. So any the other bullet point here that we really wanted to point out is we really only can correspond with you with the email address that you have used to register with at CMS. So certainly you can, we can talk to you on the phone, but as far as email goes, our system will only send emails. It will send automatic emails, and it will only send emails to those email addresses registered with CMS. So we've provided the website here in order to update your information with CMS so that you can confirm that you've got the correct email address that you want out there. Our last bullet point here about helpful tips is regarding patient encounters. When you attest, there will be a page on there regarding your patient volume and how you've reached the 30% threshold for Medicaid encounters. 9 times out of 10, what we will need from you is a detailed Medicaid patient encounter report that shows the name of the Medicaid patient, the date of their birth, and the service date that you saw them. It makes the process go more smoothly and a little faster if you go ahead and attach this report to your attestation. On the bottom of each page on the attestation, there will be a button that you can click on to attach documents, and it should be self-explanatory. When you see the button, you should be able to easily upload documents to it. And certainly if you have any problems, let us know by the email listed on this page.
Okay. Melanie, as we've said before, you have been attesting since 2012. From your experience with the EHR incentive program, do you have any additional tips you can share through your experiences all these years?
Well, first I will add to Karen's that make sure you attach your Medicaid patient list. Otherwise, you will get a message from the state asking you for it. So it is not listed as a requirement when you are attaching all of your data. So if it is a secure way to go ahead and do that, otherwise you're going to be faxing it later. So I would say go ahead and do that. The other thing is the people at the DHS office are very helpful. If you have questions, ask them, call them. They are busy people, but they do get back with you and can help you with your questions during the process.
Thank you. Thanks, Melanie. Okay, our next slide, we talk about a couple of pieces of very important information we want it to be sure to get across. The deadline for attesting to program year 2016 is April 30th, 2017. And this is the final year that eligible providers and eligible hospitals can start the attestation process with the Nebraska Medicaid EHR incentive program. So if you haven't submitted an attestation for the EHR incentive program and you would like to, you need to get your attestation in by April 30th of 2017, or you won't be able to participate in the program at all. It's the final year that you can actually submit an attestation.
Melanie, I keep asking for your experiences, and you've been very helpful, and I think it's much appreciated by our listeners. In the overall sense, the view of the EHR program in toto, can you share with us your general view of how it has worked for you and your group?
Well, it's been an asset for our group. Like I said previously, the extra income has allowed us to stay technologically where we need to be. And as we all know, that is a challenge on a daily basis sometimes. And then the data that you're encouraged to collect really does encourage you to use your electronic medical record meaningfully. That's what meaningful use is. You're attesting to using it as you should be using it. So the government's whole purpose in this process was to help people better care for patients. Some days I think it works to help us do that, but there are still a lot of things in our electronic medical record that we can learn to use and use better. So it has been helpful for us and has encouraged us to stretch our boundaries there.
Very good. Thank you.
Okay. So now we are able to answer any additional questions that have come in on our EHR mailbox, but certainly go ahead and ask more questions because we've got enough time here to answer questions that come in. We've got our email address listed right there, and then our website is below that. That's just a reference for you to go to and use when you're attesting or to find out more information. there is the opportunity when you go to that website to subscribe. So anytime we've updated the website, you will get notification. And we recently did give it a facelift, and so it is much more user-friendly now. So if you haven't been to it in a while, we encourage you to take a look and just see what resources and information you might find helpful on it.
Okay, we have had several questions come in. Many of them are specific to being able to participate. So Karen Moran is really our program specialist who understands the program in depth, and so I will be turning these over to her and reading them as they were emailed. I do want to say that I think it stresses that this is a program that is looking at individual provider enrollment rather than facility. So one question we have is coming from UNMC College of Dentistry, and the question is, can we participate as a college, and will we still be able to participate in the enhanced Medicaid?
Well, for the first part of it, like that other question that was talking about a nursing home, again, we would look at specific providers only. It's this program, you don't attest as a college or as a facility on a whole. The provider attests individually. So as long as they're dentist, we can certainly look at their eligibility and see if they would qualify for the program. And then I'm not sure what the second part is about the enhanced Medicaid. So if you'd like to just maybe send a clarifying email in, I'd be happy to address that.
And some of the more detailed questions that are coming in, we will certainly, if we do not address them in this format, we will be responding to these emails. We'll respond to all of the emails to make sure that your questions were indeed answered. So the next question is, when will the program open to start the attestations?
Well, for program year 2016, that's ongoing. You can attest at any time for program year 2016. And the deadline for that is April 30th, 2017. As of January 1st, you can start to attest for program year 2017. We changed the deadline to from February to April this year. In the past, our deadline has always been the end of February for providers to attest, but because of the final rule coming out late from CMS, and in order to give our providers additional time, as well as acknowledging that this is the final year that providers can start to participate in the program, we wanted to give providers the most opportunity that we could to get their attestation in. So that's why we've extended the deadline period.
We have a question of an individual who is trying to determine if optometrists are eligible.
Optometrists are not eligible in the Medicaid program. However, they may qualify for the Medicare EHR incentive program. So if you're an optometrist, I would encourage you to reach out to CMS directly and see if you might qualify for their program.
Excuse me. We have a question, will a PA in a school-based health center be eligible?
Possibly. This is a question that I received recently, and so I've been trying to do a little research into it. The biggest thing to remember about physician assistants is that they need to be leading in some way, shape, or form the clinic, and they need to be practicing in either a federally qualified health center or a rural health center. For all physician assistants, when they attest, documentation has to be uploaded onto the attestation that shows how they are leading the clinic where they're working. So sometimes this kind of requires a little bit more information specific to your situation. And so I will, like I said, I'm doing a little more research into this school-based question, and I will definitely reach back out to you as soon as I determine an answer.
We have a question here, excuse me, that may actually go to Melanie, and the question is, can billing be done on this system? Do you do billing on your system?
Yes, our system does everything, but the EHR incentive program is not specific to one EHR. We live in America, we have all kinds of options always for everything, including electronic medical record systems, and so a lot of the electronic health record systems that are available, you can do your billing from the same system that you chart in.
And so, Karen, I know that there are resources on our website that assist providers in looking at various EHR systems to see if they qualify for the incentive program. Can you speak to that a little bit?
Yes, we do have some resources available to see if you might qualify for the EHR incentive program, just to kind of do a walkthrough. It's just a few slides long to see if you might qualify. As far as a specific EHR program, medical record program, as a state, we can't suggest or refer you to one or the other. But, certainly you can look around because there are a lot of different programs out there, and one may fit your practice better than another one.
Thank you. I believe the same individual who asked the billing question, and I think this is a question for you, Karen, is can this be used by mental health providers?
Well, for the Medicaid EHR incentive program, the program that we run, it's just those 5 specific provider types. Now, we have had mental health practices where a nurse practitioner works in the practice, or a medical doctor, and so they have qualified because they're one of the eligibility provider types. As far as other mental health providers, they wouldn't qualify through our program, but again may qualify through Medicare. So I would encourage you to reach out to CMS directly and see if you might qualify.
Okay, thank you. There's no other questions coming in at this time, so I'm going to ask for the next slide, please. Just as a refresher, this is our full contact information. We will be, as I speak through this slide, I will be looking for any other questions. This webinar was an initial EHR Incentive Attesting 101 presentation, and we anticipate that there would be deeper questions, and we will look forward to seeing those at our email address that is listed on this slide. There is the number too that you can call. We urge you to use the email address simply because it provides a paper trail answering your questions that you can refer to as we go through the process of delivering information to you. I'm not seeing any further questions, so I'm going to take a moment to thank everyone here. Melanie, thank you so much for sharing your experiences, and the staff for putting this together and providing this webinar opportunity. Thank you to all of you who did log in and who submitted questions. And once again, I want to remind you that our website, as Karen has mentioned a couple of times, has been refreshed. We're hoping that it is much more user-friendly. It will house not only the enhanced PowerPoint presentation for this webinar, which is currently there, it will also house the recording of the webinar itself and any questions that came in during the webinar and any subsequent questions that are relevant to this webinar will be put together in a frequently asked question and posted there as well. Thank you for your time. Have a wonderful day, and this constitutes the end of our webinar. Thank you, everyone.